Good morning, good afternoon. This is Taylor Mawyer, and I'll be one of the two presenters today for today's webcast on WandRemote Plus technical configurations and best practices. Our little webcast lessons here. Your phone has been automatically muted, so we have a Q&A panel if you join the WebEx where you can ask questions. Any questions that are asked will be answered at the end of the presentation. So let's get started. So background on today's presenters. My name is Taylor Mawyer. I'm a technical consultant at Galen Healthcare. I've been at Galen for around a year now, but have 7+ years of healthcare IT experience in a variety of facets. And I've been involved with several Wand implementations at previous employers, in addition to some work on Unity and Wand here at Galen Healthcare. And I'll let Dan introduce himself.
Hi, I'm Dan Williams. I've also been at Galen for about a year. I have about 10 years in IT experience, about 15 years in security past that, and you know, very interested in the healthcare industry. So it'd be nice to communicate some fun information to you today.
Yep, exactly. So we'll get started with the overview. I'm going to start the presentation off. I hand it over to Dan, and I'll finish up with the last two bullet points. So the purpose of this webcast is to review these following items as they relate to clinical adoption of the Wand and Remote Plus products that have been developed by Allscripts. First, we'll introduce and review the mobility options provided by Allscripts TouchWorks users and briefly describe and review some of the existing functionality. Second, Dan will go over the component that drives the mobility for Allscripts. That's their Unity component, and some of the best practices we've encountered during our technical service offerings for setting up the Unity platforms. And third, I'll go over the concept of mobile device management that everyone considering Wand adoption is or that is currently using Wand adoption should strongly consider integrating into your environment. And then finally, we'll close the webcast with an overview of auditing and reporting options provided through Wand. So why are we talking about mobility in healthcare? Well, I've got a couple great graphics here that explain that the trend in utilization of mobile devices is not only across the nation, but more specifically into the healthcare industry. Really, the trend in mobility in healthcare is driven by the market. There's a Pew Research poll published last year that said that around 64% of all adults in the country have a smartphone that they use on a daily basis. And this graphic further brings that down into the clinician, where there's 6.4 million mobile devices being used daily by your average number of clinicians. 66% of doctors use iPads or tablets for medical purposes. And then 70% of physicians use their smartphones to research medications at least once a week. The trend doesn't stop with physician adoption. What I like about this graphic is that it gives the perspective of physicians and their intended thoughts or use of how health can, one, improve patient health and outcomes, but also how they would like to see their own patients be able to use mobile applications to upload data into their EHR or other applications that are used in the organization. We've noticed this trend here at Galen. We've developed products like Dragonfly that focus solely on patient-physician communications and monitoring of chronic disease management. Also, payment reform will be trending towards reimbursement based on episodic care that will be driving patient usage of mobile applications to track their progress and provide quality data to be ingested into a reporting measure for reimbursement for these episodes. And this will be in lieu of face-to-face physician communication as the patients recover at home or in different venues such as home health or SNFs during their recovery. All right, so we know the trend in mobility is here to stay. So let's get started by introducing our first poll question.
Thank you, Taylor. So for the first question, we're interested in how your organization currently integrates mobility. So I'm going to open the poll, and if you wouldn't mind just taking a minute or so to answer. It looks like, I'll start reading. It looks like right now there are a majority of people that are using either vendor-developed apps or they don't have anything yet, but they're sort of working on it. So we have a good mix of people. So I'll leave this open for about 30 more seconds, but I'll pass it back to you, Taylor.
All right, thanks, Alan. So from a vendor-developed app, you all are probably already familiar with Allscripts mobility solutions. If not, you'll get plenty of information in the next couple slides. So Allscripts has done a good job of understanding the trend in mobile utilization, and they've developed several mobility solutions to support the diverse nature of mobility usage. This has really been guided by their Chief Innovation Officer, Stanley Crane, and his insight and knowledge into the mobile market. And one thing that they've done, originally Allscripts focused their mobility solution on a PDA. I don't know if you remember the iPacs if you've been on Allscripts for a while, but the iPac was the solution for providers in clinic, mostly from a dictation perspective, is what I was familiar with. Recently, Allscripts sunset that with the 11.4 build, and they've introduced over the last 2 years, or 3 years, really 2 products that focus on mobility and mobile devices. The first one is Wand for TouchWorks. This is utilized on an iPad or an iPad mini. They've also recently released the Wand for Windows, which is similar to Wand for TouchWorks, that's available on Windows 8.1 and is driven with the Microsoft Surface offering. Remote Plus is their second offering. It's been around a little bit longer, and it's utilized on the iPhone or other smartphones, such as a Microsoft or Android phone. So a little bit about Wand for TouchWorks. So there's been many iterations of Wand for Enterprise or Wand for TouchWorks. It's primarily built for tablet computing, but it's been developed over the past couple of years with under the code names of Wombat and Hornet. And the most recent addition is Wand for TouchWorks. Wand for TouchWorks uses Unity as the driver of data between the device and the TouchWorks database, and add more functionality than the previous versions of Wand. So some of the key features and functionality for this version of Wand is chart review, charge, orders, order entry, notes, the ability to enter structured or unstructured notes, text templates, dictation, whether it's recorded via the built-in microphone that is on all Apple devices and also included in the Surface. And for the Wand product in particular, it has built-in functionality for voice recognition, whether it's through a nuanced Dragon product or in modal. So suggested use cases for this product, we feel that it's particularly useful for clinic or triage workflows, meaning exam room checks and reviews by a physician or their staff, or triage on check-in, where you have your vitals and allergies, meds, problems reviewed before being seen by a physician. So I've decided to wanted to attach some screenshots from either of the applications to give you an idea of how Wand differs from your typical IE browser interface that you're probably most used to in the clinic environment. On the left, we have an image taken from an iPad. You see it's in the format of the iPad, pulling down an appointment for for a test physician, and you can see that it's pulling down the schedule for today's physician, and you'll see that behind that you'll have what is the makings of a chart for that patient that is in view. On the right-hand side, you have two screenshots taken from the Wand for Windows application that utilizes the Surface tablet, but it's pulling the patient's chart where it's showing vitals and alerts at the top, and then down below it's more of the full this is their rendering of the patient's chart viewer, or the clinical desktop, that shows the number of, instead of a chart viewer listing, it provides various windows and boxes with a count of the discrete elements that are placed in each of those sections. So as you can see from the previous screenshots, that there is a difference in look and feel between the desktop IE browser and the Wand application. So as you can imagine, there's a little bit of a difference in workflow in using those as well. This screenshot is, these files are taken from some work we've done on our professional services side on Wand readiness and workflow adoption for clinics. And just wanted to show you that one, the workflow is different, and two, there are ways that we can help you address that workflow during your consideration of adopting some type of mobile technology and workflow for your Allscripts product. All right, the second component of Allscripts mobility solution is the Remote Plus. This is definitely older than the Wand, and there are a lack of some key features that are in the Wand application, but it's mostly because of the form factor and the design and use of an iPhone versus a tablet from a clinical standpoint. So the Remote Plus is built for the smartphone market, and it's the second iteration of the Remote product. If you're an early adopter of Allscripts mobility products, you may remember the Allscripts Remote, which ran on the Cobra platform. Remote Plus was built to replace that and use the Unity platform, but also add some key features and functionality that even more so than Remote. Some of those features are chart review, e-prescribe, task, note signing and review. Typically, this application is great in a on-call or rounding environment, where the physician may be getting a call from within their house or on the road, or be sitting in a hospital without access to the application, the ambulatory side application. They can get access to a chart to review some allergies based on a call they received, or can use this to sign notes and tasks when away from the office. So if you like how Wand and Remote Plus look, you like their features and functionality, Allscripts has developed a readiness checklist that I've taken some of the questions on to help you really think through implementing Wand in particular in your particular organization. So a couple questions that they asked that you should maybe think about before really moving forward are the following. How will Wand be supported? Is Wand going to be supported by a super user or someone within the clinic? Or will Wand be a call to the IT help desk? And you have to also take into account that Wand is difficult to be remoted into to determine what is going on with the application. So the lack of insight into the iPad tablet is a factor here when you're determining how it will be supported. Second one is a big question. How will your organization purchase the devices? Is it going to be an employee purchase, bring your own device policy, or will it be a corporate policy of providing devices in the clinic that will remain within the practice or the organization? Third question is, does your organization currently use Unity? Or do you currently have products that integrate with the Unity platform? Or do you need to have an assessment to determine how you need to build out Unity? And Dan will shortly speak to that. And then the last one that I have that I think is important for you to understand and think through is how the workflow will impact the adoption of Wand. So how will Wand impact your workflow? You know, some examples are exam room usage. Will you use this for after hours or urgent care clinics? Is this going to be solely focused for a patient intake or triage process? Or are your physicians going to be able to use this device, or would they want to use this device for rounding in the acute care space? So with that, we're going to get to our Unity focus section, and I'm going to hand it over to Dan.
Thank you, Taylor. So we will be going over what Unity is in a particular environment. Unity used to be called Cobra, which some people are familiar with. It was also called UAI for a bit until it got up to version 4 when Allscripts started calling it Unity. And it has actually come quite a long way. It's about 4 times as useful in terms of application commands than it used to be. It works with many different applications to sort of transfer patient data between a TouchWorks environment and a particular device or application. It works as sort of a real-time updater that transfers information back and forth between applications or devices, and it sort of has its hands in a lot of different things. It works with remote, prenatal, ARN, Welch-Allyn devices, MedFlow, HealthBench, and it has another component within it called the UAI desktop agent, which also works with our component eCalcs, as well as prenatal and some other applications. Unity has a bunch of components, and it's the kind of software where when it works, it's seamless, and you don't really sort of know the involvement that it takes for a particular IT team or implementation team to get it going. It has a lot of components to it. There are SQL pieces or SQL. There is the web application. There's application pools within IIS. There are also binary files, and as mentioned before, the desktop agent. So since Unity is able to connect to all these different applications, it is important that when you are initially doing your assessment for whether your organization wants to use Wand or Remote Plus, that you make sure to have a specialist, such as Galen, fully assess the environment to make sure that everything is good with Unity, so that communication can work seamlessly throughout your environment. The way that Unity is able to work in Office through TouchWorks and through applications on the network, it just connects to a Unity server. With other devices, such as Wand or Remote Plus, it is able to connect through Wi-Fi over the network to communicate with the Unity server, which will then work with the TouchWorks server. Now to go over the server specifications, they are, for Unity, is essentially the same as a regular TouchWorks installation, more similar to a print or web message server, or web server, sorry. And essentially what you'll want to have is 2 processor cores for every 200 connections. That means however many of your users are connecting to through Unity to the TouchWorks database server. For large organizations, this can actually be quite a bit. I've seen many organizations that will get thousands of connections a day, or per hour sometimes, and you want to make sure to have a beefy server that can handle that. Minimum is 4 gigabytes of RAM, 5 gigabytes of hard drive space, and 36 gigs for a RAID array within the server, sort of to promote continuity so that the Unity connection does not go down. And with that, we recommend, and Allscripts recommends as well, that you create a dedicated Unity server to handle any of the communications, especially for any Wand devices. that you have in your organization. That reason being, it sort of maximizes the level of uptime in communicating back between your server, or between your TouchWorks server and the device, so that you can have sort of a seamless transition. But it's very convenient, and devices are able to plug into it rather easily and communicate data back and forth. And like I said, it's one of those pieces of software where when everything is working smoothly, it's sort of magical that it's able to work so well. Next, we'll go over just sort of a rough outline of how it would communicate within the network or within the office. You can see here that essentially you can connect your iPad to the Wi-Fi in the office, which most offices have these days. The same with your iPhone or other smartphone device. There are ways to connect through their network, through cell phone service provider network, but we recommend for maximum security is to do it through Wi-Fi within the network. And you can see here that the devices go through the intermediary of the Unity server, which then connects back to the TouchWorks database server. And then, of course, as a user within the office on a PC, you would be able to connect through TouchWorks itself. The next slide is to show sort of a rough outline of what it looks like when you're outside the network. The way that you would connect your devices is through a public-facing IP address, which would then redirect any traffic that comes into your environment or direct it to the Wand and Unity server to sort of maintain communication. And typically you would connect through Wi-Fi in your home, or as I mentioned, you can connect through your cell service through Remote Plus. I typically recommend setting up a VPN tunnel between any kind of location that you're at, just because nobody likes a HIPAA violation. Even though most cell phone, or I should say all cell phone communication these days is secure, it is good to sort of get that level of assurance. Okay, so that is just to give you an idea of what is set up, or a sort of general idea of how that's set up. And then we have our next poll question.
Thanks, Dan. For the second poll question, we're interested in your greatest concerns with implementing new technology. So let me just open up. Sorry. We'll open. Sorry about that. So we're going to open this up. So we're just interested with your greatest concerns. So either if it's another option that you have to implement, security or cost, or any that you might have. So right now it looks like in the lead is security, and then we've got a few people with that have answered none, a couple people. It looks like it's pretty even across the board with most people. Their major concern is security. So again, I'll leave this open for about 30 more seconds, but I will pass it back to you, Dan.
Thanks, Fallon. I'll give it a few more seconds before we move on. Okay. So when Unity connects to your network, either from outside the environment or within the environment, it uses it can use an SSL connection. Oddly enough, you get the option of enabling the SSL connection within the environment, but Galen and Allscripts 100% recommends using the SSL connection because it is secure. It safely transmits the data and does so through industry standard encryption, and the devices will actually time out if you have not used them after a period of about 20 or 30 minutes. And this is to basically protect any data that may be open on the device when you're working on it, as well as clearing out any kind of data that was temporarily being stored on the device. As we all know, patient data is one of the most precious things that we handle, and we have to make sure to take care of that with the utmost level of scrutiny. So it is infinitely recommended to use an SSL connection when you have that set up, and that's something that your implementation team is able to set up securely, where you would typically set up a certificate on the Unity server, so that any devices that come in through the firewall or just come in through the local router would be able to verify that it is a secure connection. Okay, so after that, we'll have any questions later on about, you know, for anything that you may want to know, since I know security is such a high point of topic these days. You know, we'll be happy to answer any questions with regards to that. But now I will throw it back to Taylor to talk about mobility.
Thanks, Dan. So, sounds like we've planned this this presentation to go in right along the lines of the primary concern, the adoption of the Wand and mobility options within your clinic. But I promise you, we didn't. This is a live webcast. So, security, by your own admission and by the market in general, is still an integral consideration to take when you're wanting to implement any type of mobile solution. So once you've made your decision to implement Wand, it's time to review in more detail how you're going to secure not only the technology, meaning the device, the tablet, the investment that you or employees made, but also the data that's on that device as well. So these are some key factors or numbers that have been reported by various surveys and reports from different healthcare institutions. So 81% of healthcare providers store personal health data on mobile devices. Whether it's Dropbox, OneDrive, or another method, you need to know that the data is out there and is being used. And without control, you don't have the ability to track, monitor, or prevent any type of breach. In addition, only 40%, at the time of this survey, only 46% of hospitals have a security strategy to regulate the use of mobile devices. And then 1 in 20 users has lost or had a device stolen that contains work-related data. And if it's involved in a healthcare institution or organization, there's at least an 81% chance that there's some type of health data on those devices. So why do you need, so we know that there's a security concern. What's out there to help prevent or reduce the risks with any type of security concerns for the adoption of mobile options like Wand or Remote Plus? The industry standard, and this is across healthcare and other industries, is that most organizations implement a mobile device management strategy for those devices. So why do you need a mobile device management solution? So mobile device management solutions are there to help keep track of the inventory, the location, what is on the device, what securities you allow or what features you allow on a device, and even what applications you allow on a device. So it's an important part of a mobile device or mobile utilization strategy for your healthcare organization. So mobile device management really helps with a couple key components of concern within implementing something like Wand. One, it helps reduce loss retention through the implementation of features such as geofencing, tracking, and blocking and wiping automation within those devices. Two, it helps supplement some HIPAA security concerns and HIPAA privacy concerns that may exist on devices that contain a product like Wand or Remote Plus. So implementing mobile device management properly can protect the confidentiality, integrity, and availability of data stored and accessed on those devices. There's industry standards that are out there to help you with understanding and building governance and policies around a mobile security platform or implementing a mobile device management platform. One of these is the NIST Special Publication 800-124 Revision 1, which provides guidelines for managing security of mobile devices in your enterprise. So one of the concerns with implementing mobile device management is there has to be a decision made in your organization on who owns the mobile device strategy. Is it a security focused? Is it a convenience focused? Or is it a mixture of the two? And typically you search for a mixture of the two. From a security perspective, you want to implement a IT and compliance governance program because one, you as an IT organization or IT position, you see from an architectural and security standpoint, you tend to see the bigger picture. You understand the trends. You understand what is going on in your organization. And you have a duty to protect the end users for what they don't know or may not be familiar with. They may not understand all of the nuances and features within a mobile device, including security settings that are really there for their protection and not for their inconvenience. But if you go too far on implementing security without really also taking into account for convenience, you may implement a solution that is so inconvenient that the user may not adopt that mobile technology. And this can occur with something like Wand, where implementing something that's too stringent on security would hinder clinician interest in using that technology. So this mobile device management, these are some steps to consider when developing a mobile device management policy for your enterprise. I touched on it earlier in the presentation when we on the readiness checklist as far as something like bring your own device. Are you going to allow clinicians or end users to bring their own mobile device, or is the company going to purchase the devices for their use? If you are implementing a BYOD policy, particularly for physicians, you need to take into consideration such as what iOS version requirements you're going to stipulate can be used in your environment. What hardware revision requirements are there? Are you going to allow an iPad Air is the latest device you're going to allow in the environment? Is it going to be the new iPad? And then what type of remote wipe implications for mixed content are you going to provide to your organization? And the remote wipe is key because with a mixed content, you could have an iPad that contains personal data or personal applications, and then you could also provide corporate assets or applications that could be loaded separately. So if you implement a remote wipe, meaning that when there's a detection that the device has left or been stolen or been compromised, you can submit a signal to that device to wipe out all of the content on the device, or you could remove and wipe out just the content that's been loaded from your organization, meaning that anything that you've provided them can be removed, and the remaining data, whether it's personal nature or something else, would remain on that iPad or tablet. As Dan mentioned earlier, you need to consider the infrastructure, particularly in implementing Unity on a web server environment, but also how that Unity device is deployed. So he mentioned SSL, use of VPN, and for a public-facing Unity server, are you going to place that in a DMZ, which is a network term for separating that server between your environment where most of your Allscripts servers are, and puts it in a middle platform between the internet and your internal Allscripts infrastructure environment. Typically, this is the best practice if you're going to implement something that is public-facing, or you can isolate that public-facing device from all the other servers in your environment. So some additional steps to consider with the MDM policy. So one thing is what type of solution you're going to get. There's tons of them on the market. So reviewing and acquiring an MDM solution is kind of key to an MDM policy. So when you're reviewing the options that are out there, these are some you may want to consider. Does it support geofencing, where it sets up parameters that use wireless and or LTE cell data parameters to determine the location of the device? So if it exits a certain area that you've fenced off geographically, it will detect that it's left the confines of your organization and will notify the administrator, and if nothing is done within a certain time frame, it could potentially wipe the device. Are you going to implement application install restrictions? Are you going to limit the features, such as the camera or the microphone on those devices? What type of password and screen lock requirements are you going to set up? And this is separately set up from what Dan mentioned regarding the Wand 30-minute timeout, where you could implement a 4 to 8-digit passcode that gets set up and implemented after 5 minutes of non-use, or 15 minutes, or 1 hour. So those are all factors to consider when reviewing your MDM solution or building an MDM policy. So this may be a little overwhelming, but these are some of the many mobile device management vendors that are out there. We are familiar with a variety of these, and we would be willing to also help you with the implementation and selection of such a MDM solution for your environment. You know, a couple of things that I've done in the past are looking for solutions that not just provide compliance and security over Apple or Android devices, but also laptops. Something like the Surface, which is the one for Windows device, that may not be covered by a mobile device management solution that focuses on a device with the iOS or Android platform. So there's a lot of things to consider, but this is something that maybe 3 or 4 years ago was a nice to have, but in implementing a security a mobile solution for your practice needs to be considered as a must-have. So with that, I'll hand it off to Fallon for poll question number 3.
Thank you, Taylor. So we're curious for this one, if you're currently using WandRemote Plus, what are its primary uses? And for this one, you can check all that apply. So it's for documentation, on-call, providers. So it looks like right now the leader is it's provider-driven. So we've got a few answers for everything. So for clinical documentation, triage documentation, on-call usage, but the leading answer that we have so far is provider-driven. I'll leave this open for about 30 more seconds so everyone can finish answering, and if you haven't started yet, but I'll pass it back to you, Taylor. Thank you.
Yeah, thanks, Fallon. So the last component of the webcast is a brief overview of the reporting and auditing options with Wand and Unity. Technically, all reporting for Wand is really Unity reported, but within the filters from Unity, you can subdivide the table to filter by application name, such as Wand for Enterprise or Remote. So we'll be covering kind of 2 questions with this this particular component: why reporting, and how to report. So why report? We'll just go over a brief business case for why you would want to report. So utilization metrics. A desktop, standalone desktop with monitor, maybe if you have a good purchasing organization with minimal requirements, you can get for $500, which makes a mobile device that can be used across multiple points of care between the $250 and $400 range are more attractive offerings. But as you grow in usage, you may have devices instead of per room, it would be per user. So as you grow the proliferation of devices in an organization, you can see that your asset and the cost of acquiring those assets can grow into the tens of thousands of dollars. And I have a graph to represent the different purchasing options in number for an iPad and iPad mini, where the last one, the highest one, is having over 100 devices in your organization that have been purchased. So most healthcare organizations are looking to reduce costs these days and not try and find ways to increase costs without having some type of business case or return on investment scenario. So if your organization is spending thousands of dollars on these devices, you need to have some type of ability to have metrics to determine usage, to provide some type of productivity measurements or a return on investment scenario to your finance or your executive level within your organization. So how do you do that? So Wand offers a couple flavors, and it's really provides a lot of insight into what's being utilized in Wand. But I'll cover 3 specific examples for the purpose of this webcast. The first is auditing options. Second are provider reporting options. And a third is reporting on clinical functionality. And I'll take that back, step back to providers. Providers mostly user-based, so you can report on users, which would typically be providers, could also be clinical staff based on how your workflow is set up. But and then the third one will be functionality, so less focused on who is doing it, but what they're doing within Wand. So auditing is accessed via your typical audit reporting, as in the TouchWorks application. It can be accessed. The same information is available within the same type of audit log that you have in the TouchWorks application. That is, it does not track duration, how long they're in a particular section. It just tracks access. So they did this particular action at this time on this patient and entered this data. The requirements for the detailed auditing are as follows. You need to be on TouchWorks 11.2 or higher. Your Unity Born On date needs to be 3/13 or later. And, of course, you need to be using Wand for TouchWorks. So this is the type of data that's available for reporting within the Unity/Wand offerings. So this example contains 2 providers, and we've taken the data out of the database and turned it into an Excel spreadsheet that tracks a physician over a week's worth of time utilizing the Wand for a particular function. So obviously this is older data, but you'll understand the point where you have provider 1 has X amount of patients being seen, they've done dictations or entered notes, and or they've taken photos within it. And you can break that down by provider, by date, to get those metrics. And the second provider has something similar. You can see that they didn't take any pictures, but they did increase their usage by the end of the week. Maybe that's because they're more familiar with the application. But you can see that over that past week, they've used at least some of the functionality of Wand within your environment. This can be broken down into multiple levels, and really the reporting is more on what functions are available to be reported on, not particularly on the format. As we found in a lot of our reporting offerings, each particular organization that we deal with has a different way they'd like to view or filter their report. So just showing you an example of one report that's been done would hopefully give you an option of what options are available, what we could help you with. And the next slide will show you a little bit more on what can be entailed in a particular report that you would want to run for your organization. So if you're running this, you want to determine and say you develop a workflow of triage for your practice, and you're wanting to look at which devices or which wand products are being used by site, by user, and what functionality that triage workflow is being done. You could do that. You could set up filters on login users. You could set up a date if you want to choose a particular date time. Most likely, well, they will be using Wand for triage functionality, but you can also report on any remote usage by physicians. And then it gives you a breakdown based on functionality such as save a note, which is just a stored procedure that's called within and stored in the auditing database that states that the user saved a note at this particular time using the Wand and was affiliated with this site. So you can get a breakdown by site and user, or you can just break it down by site that says this site had this many vitals entered today, and you can on the patient scene at that site. So it gives you a lot of flexibility in creating reports that you can use to get that return on investment, or build your case for maybe providing that device to another user because that particular user hasn't been utilizing Wand like it should have been, or like they had promised they would have been doing over the past couple months. So there's many reasons and ways on reporting, and the goal was just to give you an idea of what those are, so you can think about how your organization would want to track utilization over a period of time for your investment or your usage of Wand for TouchWorks in your environment. So that wraps up the presentation part of this webcast, and wanted to mention that you can follow us on Twitter, Galen Healthcare, @Galen Healthcare, for future blog posts and webcast news. We've been live tweeting from HIMSS this week. Got some great feedback, and really enjoyed being out there in the digital space for social media. But we'll see if we have any questions, and we'll be glad to answer those. So one question.
Go ahead.
I have one right here, Dan. So is it possible to have Wand and Unity installed on the same server? Dan, do you want to tackle that question?
Yes. They can be installed on the same server. It is typically recommended to have just a dedicated server to sort of any internal and external communications, but the impact of any Unity application as well as interacting with Wand is more than sufficient on one server. And I see here there is a question: how easy is it to install? You want to tackle that?
Yes, yeah. It's so Allscripts provides great documentation on the installation of Wand and the configuration of installation of Unity and Wand, for that matter, across the spectrum of device type. So if you wanted to set it up in your test environment or in production, you could get the documentation and really install it without any support within 30 minutes to an hour time frame. That's one of the benefits of Unity. If installed correctly, as Dan mentioned earlier, it behind the scenes it's running, but it's simple adoption by any organization. And see, looks like there's one more question. How do you build out new OneNote templates? Lots of V11 experience. Just curious to see which model section to go to. So that's a great question. we have, so I guess this is a two-part answer. One, it's a lot of it is native to what's already been built out in text templates, but there's certainly specific templates that can be built for WAND usage, particularly as you have certain workflows. And what I would say is that it can be done, and that I would say that it's probably best to maybe get back to you all with our professional services team that has experience with doing this. We certainly have instances of this being done. We have some examples that we could provide and help guide your organization in focusing on maybe generating specific WAND templates to be utilized, because that would be that's actually a great question and a good point to use for your adoption. Would certainly help with that adoption if you could really narrow down usage to certain text templates to make that usage of the iPad more easier to use, I guess would be the best way of saying it. All right, well, that appears that that's the end of the Q&A session for this webcast, and just like to thank you all for joining. Hopefully you've got some great feedback from us on how to implement WAND, and we'd love to help you integrate different solutions, particularly around WAND and mobile device management. So thanks again for your time, and have a great day.